Hi, I am Yoon-gu Kang, a medical oncologist from Asan Medical Center, Seoul, Korea. Today, I will briefly introduce one of our retrospective study, the impact of L-carnitine on imatinib-related muscle cramps in patients with GI stroma tumor. Muscle cramps is involuntary muscle twitching that are accompanied by pain or muscles hardening. It constitutes one of the leading adverse events of imatinib, with the incidence of around 30%. Although the muscle cramp is not life-threatening, it could adversely impair patient quality of life, resulting in a delay or discontinuation of anti-tumor therapy. So the therapeutic options for chemotherapy-induced muscle cramps so far remains at the level of conservative care, like stretching and massage. Although the supplements of various microelements, including quinine, taurine, vitamin E, alumina, zinc, magnesium, and calcium have been reported previously, their impact remains unclear. Despite not fully elucidated mechanism of muscle cramps, impairment of energy metabolism is considered to play a pivotal role in developing muscle cramps in patients with chronic disease. So L-carnitine, an ammonium compound which is synthesized endogenously by kidney and liver, and also supplied by dietary intake, which is rich in red meats, acts as a transporter of long-chain fatty acid into the mitochondria to be oxidized and produce energy, which is essential for releasing the actin-myosin bond. So the L-carnitine deficiency could result in impaired muscle relaxation and could be one of the potential causes of muscle cramps. Prior studies suggesting efficacy of L-carnitine includes, firstly, carnitine deficiency in more than 30% of cancer patients at the baseline. And secondly, carnitine supplementation affects relieving muscle cramps in patients with liver cirrhosis and those receiving hemodialysis. And recently, a case report of two patients with chronic myelogenous leukemia who developed muscle cramps after imatinib and successfully treated with L-carnitine. So we tried L-carnitine for relieving muscle cramps associated with imatinib treatment in patients with advanced GIST. And this study aims to assess the impact of L-carnitine on relieving cramps in patients with GIST taking imatinib. We reviewed the medical records of patients in our prospective database of GIST who experienced muscle cramps accompanying moderate to severe pain, which corresponds to a numerical rating scale 4 or higher after imatinib treatment, and received L-carnitine for muscle cramps during 2016 and 2017. All patients were asked to report the severity, frequency, and duration of muscle cramps before and after taking L-carnitine during outpatient clinic visits. We used the numeric rating scales to measure the pain intensity of muscle cramps, and in addition, disturbance in basic activities of daily living, ADL, instrumental ADL, IADL, and outdoor activity, or sleeping, and scoring for the overall quality of life before and after L-carnitine treatment were assessed using a questionnaire. We also measured the blood carnitine level in a subset of patients whose blood specimens were available at their visit. A total of 42 patients were enrolled in this study. The median age was 60 years. Most patients were taking the standard dose of imatinib, and most of the patients were prescribed 500 milligrams 2 times a day, and the residual 30% of patients 3 times a day of L-carnitine based on the physician's discretion. And median duration from initiation of imatinib to the start of L-carnitine was about 3 years. The average baseline intensity of muscle cramps were 6.3 points by NRS, and average baseline duration of muscle cramps was 18.3 minutes, and the average baseline the frequency of muscle cramps was 2.5 times per day. By location, calf and hands were the most frequently involved, and the patient reported that muscle cramps were typically triggered by stretching or extension motion, repetitive movement, putting strength on muscle, or sleeping. In addition, some patients reported that cold weather or walking worsened and the muscle cramps. And patients report that they had been trying a massage, resting, moving softly, painkiller, or bathing to relieve the muscle cramps. In left panel, you can see that the intensity of muscle cramps decreased significantly from median 6.5 points a day to 2 points a day. In right panel, you can see that in 83.3% of the patients, the NRS score declined to less than 4 points, and 10 patients actually experienced complete disappearance of the symptoms. In duration of muscle cramps, there was also significant improvement. In left panel, you can see that the duration of each episode was shortened from median 5 minutes to 2 minutes. In right panel, you can also see that most of the patients had improvement in duration. There was also an improvement in the frequency of muscle cramps. In left panel, you can see that the frequency declined significantly from a median 1 time per day to 0.1 time per day. Regarding the quality of life, approximately 3/4 of the patients at the baseline experienced limitations in ADL, IADL, sleeping, or outdoor activity because of the muscle cramps. We observed a substantial improvement in all aspects of the quality of life after 3 months of L-carnitine treatment. When we asked how they would rate their overall quality of life disturbance, patients gave marks on 7 points in the median at the baseline, which went significantly down to 3 points after L-carnitine treatment. Of the 35 responders, about 2/3 of the patients continued L-carnitine replacement without the aggravation of the muscle cramps. And after the withdrawal of L-carnitine, after discussion with the patients, in 9 responders, 8 remained the remission of symptoms. Only 1 experienced worsening of muscle cramps. And 7 patients who had persistent muscle cramps even after L-carnitine replacement. One of them had the lumbar disc herniation, which was accountable for his muscle cramps. And after eliminating other possible causes of muscle cramps, physicians decide to describe dose escalation or higher dosage of L-carnitine to the remaining 6 non-responders. and half of them state that they had additional benefit by increasing the dosage. And we had tested the blood counting level at the baseline in 12 patients, and no one reported definitive carotene deficiency. The carotene level at the baseline did not correlate with the severity of the pain. And in 10 patients who had paired results of the blood carotene level before and after L-carnitine treatment, the carotene level significantly increased from baseline to treatment period. So in conclusion, this study, although it's the retrospective study, suggests that the L-carnitine supplementation is well tolerated and effective in the treatment of muscle cramps in patients with GIST taking imatinib. And based on this result, we have initiated a randomized placebo-controlled trial to confirm the effect of L-carnitine on the imatinib-related muscle cramps. But unfortunately, because of the poor patient accrual, the study was closed prematurely. And you know, this is non-toxic and very cheap treatment. So the patients want just treatment, not want to include it in the placebo. Thank you very much for your kind attention.